The term narcotic, derived from the Greek word for stupor, originally referred to a variety of substances that dulled the senses and relieved pain. Today, the term is used in a number of ways. Some individuals define narcotics as those specific opiate derivatives, such as heroin or morphine, while others refer to any illicit substance as a narcotic. In a legal context, narcotic refers to opium, opium derivatives, and their semi-synthetic substitutes. You may hear some other terms used to describe a narcotic. While narcotic is the term we will use throughout this video, you may also hear persons refer to opioids or opiates. For the purposes of our discussion, the term narcotic refers to drugs that produce morphine-like effects. Narcotics are used therapeutically to treat pain, suppress coughs, alleviate diarrhea, and induce anesthesia. Narcotics can be administered in a variety of ways. While many are taken orally, they can also be administered transdermally through patches, or they can be injected. There are also narcotics available as suppositories. As drugs of abuse, narcotics are often smoked, sniffed, or injected. The effects of the drug depend significantly on the dose, the route of administration, and the individual's previous exposure to the drug. Aside from their beneficial medical uses, narcotics produce a general sense of well-being by reducing tension, anxiety, and aggression. While these effects can be very helpful in a therapeutic sense, they also can contribute to their abuse and addiction. As a care provider, you will likely encounter narcotics at some point in your facility. Narcotics may be used by your clients for therapeutic benefits, particularly for pain relief. During this video, we will discuss the importance of the safe use of narcotics within your facility, with particular attention paid to controlling and safeguarding the medications within your facility. One of the most likely reasons that a client in your facility will take a narcotic is to control pain. Pain-relieving medications, also called analgesics, fall into three general categories: narcotics, non-narcotics, and combination drugs, which contain both a narcotic and a non-narcotic. Examples of narcotics include morphine, codeine, oxycodone, fentanyl, and methadone. While non-narcotics include aspirin, acetaminophen, as well as the non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen. Typical combination drugs include Tylenol number 3 and 4, which is Tylenol combined with codeine, as well as Vicodin, which is a mix of acetaminophen and hydrocodone, and Percocet, which is acetaminophen and oxycodone. The first narcotic identified in history was morphine. Opium, which contains about 10% morphine, comes from the juice of the poppy seed and has been used throughout history to relieve pain and produce euphoria. In 1803, a German pharmacist isolated morphine from opium, and with that discovery, the use of the drug proliferated. Even today, morphine remains the prototype of the narcotic analgesics. The problem of morphine dependency was not recognized in this country until the time of the Civil War, when morphine was widely used in treating wounded soldiers whose addiction subsequently became a significant social problem. Unfortunately, all narcotics have the potential for abuse and addiction, and this remains a major objection to the use of narcotic pain relievers for chronic pain. As a result of these fears, many doctors are reluctant to prescribe narcotics, and many persons with chronic pain are reluctant to take them. However, it's important to understand the elements of addiction and how they relate to the proper use of narcotic pain relievers. Physical dependence is an automatic consequence of taking narcotics over time. Physical dependence becomes apparent when someone abruptly stops taking the drug or reduces the amount they are taking. This leads to withdrawal reactions. which in the early stages can include runny nose, goosebumps, and sweating. However, this progresses to more serious symptoms that include restlessness, difficulty sleeping, muscle twitching, hot and cold flashes, abdominal cramping, and even nausea, vomiting, and diarrhea. Physical dependence is not the same as an addiction and can be avoided under the appropriate guidance of the client's physician. Proper dosing, proper adjustment of doses, and avoiding abrupt changes or cessation of the medication can avoid these types of withdrawal symptoms, which can not only be uncomfortable but could even be life-threatening. Tolerance is another important term when talking about addiction. Tolerance refers to the fact that the drug loses its pain-relieving effectiveness when used over time. In other words, tolerance occurs when you need to take more of the drug in order to obtain the same degree of pain relief. Many persons with chronic pain who are taking narcotics are able to maintain their dosage level without continually escalating the amount taken. Again, the proper guidance of the client's physician is vital in this area. Addiction, on the other hand, is unlike physical dependence and tolerance in that it is more of a psychological concept. It refers to a basic psychological dependence and craving for the medication. It refers to people who take more of the drug than they are supposed to, or seem to have little control over the amount they take. Persons who are addicted to narcotics take them for their psychological effects rather than for pain relief. That is, they compulsively use narcotics to reduce emotional suffering. If you suspect that a client may have any of these challenges, be it physical dependence, tolerance, or addiction, it is vital that you contact their physician immediately. This individual should be consulted with their physician and likely other specialists to treat these challenges. Today, dependency and addiction can lead to narcotics being inappropriately prescribed by physicians or even stolen by nurses or other staff members with access to the medications in your facility. The act of a medical professional stealing or misprescribing a narcotic medication is known as drug diversion. An example would be a nurse or a medication aide claiming that a client had pain and they gave them their narcotic, when in reality they documented that the narcotic was given, but they took the medication for themselves. There have also been instances of staff members in facilities diverting narcotic medications, that is, taking them or stealing them from the facility, to later be sold on the street for illicit drug use. The concepts that we will discuss throughout this video are targeted at ensuring the safe use of narcotic medications by your clients and avoiding diversion by staff members. In 1970, a federal law known as the Controlled Substance Act was passed to help control the use of narcotics. The Controlled Substance Act classifies drugs based on their abuse potential and clinical usefulness. Drugs in each schedule are regulated by a set of rules specific to that group of medications. Your understanding of these schedules and the rules that accompany them is critical to achieving our goals of safe and appropriate narcotic use within your facility. The groups of medications defined by the Controlled Substance Act are referred to as schedules. They range from Schedule 1 through Schedule 5, with Schedule 1 containing the most serious drugs. Schedule 1 drugs are defined as having a high potential for abuse and no accepted medical uses according to the federal law. These drugs include heroin, LSD, marijuana, and other illicit drugs. They are, of course, banned in the United States. Schedule 2 drugs have a high potential for abuse, but do have accepted medical uses. There is the risk with Schedule 2 drugs for physical and psychological dependency. These drugs include codeine, amphetamine, morphine, and pentobarbital, just as a few examples. Some rules to be aware of for Schedule 2 drugs. Prescription refills are not allowed. So each time a refill of the medication is required, a new prescription must be written by the client's physician. Physicians must have a special license through the federal government to prescribe Schedule II drugs. Schedule III drugs are medically accepted medications which may cause dependency, but abuse is much less likely. These include medications such as codeine, hexabarbital, and others. Schedule IV drugs are medically accepted and have very mild dependency, with abuse unlikely. These would include diazepam and phenobarbital. Finally, Schedule V drugs are medically acceptable and have a very limited potential to develop dependency. Schedule V drugs would include cough syrups that contain codeine and other drug compounds with small quantities of narcotics. There are a number of important steps you can take to help control the use of narcotics within your facility. Number 1, follow your facility policy. Check with your supervisor, administrator, and policy and procedure manual to verify the appropriate steps you should take when handling narcotics in your facility. Number 2, keep them secure. This is one of the most important things you can do. Take steps to ensure that narcotics do not fall into the hands of unauthorized persons. Number 3, closely follow physician's orders. Number 4, document the use of narcotics. Anytime a client requires a narcotic or anytime you administer the narcotic per the physician's order, document this. Monitor clients who are using narcotics. Watch for any side effects or adverse effects from the use of narcotic medications. Number 6, count drugs at the change of shift. Now again, you will want to check with your facility policy as well as your state regulations regarding second counts. One of the simplest but most effective things you can do to ensure the control of narcotics within your facility is to ensure that they're properly secured. All medications in the facility, but particularly narcotics, must be locked at all times. Whether they are stored in a medication room, a medication cabinet, a medication cart, or perhaps even stored in the client's own room, medications must be kept under lock and key. In many facilities, narcotics will also be stored under a second lock. For example, in a medication cart, you may find a container within one of the drawers that has another lock. It is in here that the narcotic medications would be stored. The second lock helps to ensure once again that only the appropriate individuals have access to the narcotic medications. This second lock is not always required, so again, check with your state regulations and your facility policies regarding second locks. Here are some additional things you can do to ensure the security of narcotic medications. Don't ever leave medications out in the open. For example, if you bring a client's medication to them while they're seated at dinner, do not leave them sitting on the table. Stay with the client until they have consumed the medication. Don't prop open medication room doors. Even if you feel you simply need to run down the hall for just a quick second to grab a phone call, even though locking the medication room door does take some of your valuable time, this is time well spent to ensure the security of these powerful medications. Monitor clients who are self-storing medications. In many states and within many facilities, some clients are able to store their own medications with proper physician authorization. If this is the case in your facility, ensure that those medications are kept under lock and key. Depending on facility policy, this may include locking the room door or having an additional secure storage area within the room, such as a locking drawer or locking cabinet. While narcotic medications can have powerful and important beneficial uses within your facility, they also can carry significant side effects that you should be aware of. Side effects to watch for in your clients can include euphoria and hallucinations, itching, rashes, flushed skin, orthostatic hypotension, a condition in which a person's blood pressure will drop when they stand from a sitting or lying position. This puts the client at a much higher risk for falls. Narcotics can also cause gastrointestinal upset, such as constipation, nausea, vomiting, or diarrhea. Urinary retention. As with any medication, narcotics could cause an allergic reaction, potentially serious allergic reaction. One of the most dangerous side effects of narcotics, particularly if at too high of a dose or too excessive in use, is respiratory depression. Many narcotic medications can actually cause a person to breathe slower and more shallow if taken in high or excessive doses. This can be particularly serious in clients who already have other pre-existing respiratory conditions such as COPD or emphysema. Finally, any person taking narcotic medication should be monitored for toxicity or overdose. Should you see any of these side effects in a client, it is vitally important that they are reported immediately to an appropriate medical professional. If you ever suspect that your client is in serious, life-threatening danger, call 911. When paramedics or other help arrive, be sure to make them aware of the medications that your client is taking. This can help the physician in the hospital to determine the root cause of the client's symptoms and provide appropriate treatment. If a person is overdosed on a narcotic or is having serious side effects from a narcotic, there are other medications that can be given in the hospital to counteract those effects and save the client's life. It is also important that you always follow your facility protocol regarding side effects and reporting. In addition to monitoring for side effects, we also want to monitor for appropriate use of narcotic medications when a client is taking them. We want to be sure that narcotic medications are used in a timely manner in accordance with physician's orders. For example, if the narcotic medication is used on a PRN basis, ensure that the client receives it in a timely manner when they request it. Do not wait for the pain to build up to the point that it is excruciating and severe for the client. The goal of the narcotic medication is to prevent pain from reaching that point. If you feel that a client is not having their symptoms appropriately controlled, speak with their physician. It may be that an adjustment of the medication is necessary. At the same time that we want to be sure they're being appropriately used, we also want to monitor for overuse. Watch carefully to see if a client is attempting to overuse a medication, particularly if they are self-storing and administering their own medications. Does a client ask frequently for a medication from staff? Does a client attempt to request the medication from different staff members with the hopes that they will not be aware of what has been administered? This is an important reason for your good documentation. If a client approaches you and asks, "My back is really hurting, can you please get my pain pill?" You want to go back and check your documentation to see when it was last given to the client. Remember, the physician's order will specify the frequency or the time between doses of a medication. If you do suspect overuse, or you're concerned that a client may be becoming dependent or even addicted to the medication, there are several factors you should consider and steps you should take. One thing to keep in mind is that for many clients, they feel that the time they have with a staff member when they bring them their pain medication is one of the few times throughout the day that they have good one-on-one interaction, where a staff member is spending time only with them. And as strange as it may sound, it may be that interaction that the client is seeking and not the drug itself. However, of course, as a caregiver, it is not our role to diagnose. If you suspect overuse, dependency, or even possibly addiction of the client's narcotic medication, speak with their physician immediately. As with any medication, properly documenting the use of narcotic medications is critical. Critical number one, to ensure that clients receive the medication according to physician's orders. Secondly, it is important to ensure you maintain a good legal record of the care that is provided. And finally, narcotics records can help to monitor and prevent drug diversion. What is different about a narcotics record compared to your typical medication records is a place to indicate or sometimes pre-printed columns for the amount of the medication. In this column, we will indicate the amount of medication that is left after we provide a dose to the client. So for example, let's say that a client is taking a pain medication to control severe back pain. The client comes to you and says, "My back hurts, could you please get me one of my painkillers?" You go to the medication room, look in their medication record, and find the narcotics record, which does indicate that they do have a medication prescribed for back pain. You check to verify that they have not recently had a dose of the medication and enough time has passed for them to receive a new dose of the medication. When you open the client's bottle of medication or look in their bubble pack, you see that there are 25 tablets of that medication remaining. You remove a tablet, place it directly into a pill cup, and prepare to bring it to the client. After you watch him consume the medication, you return to the narcotics record to document. Looking again at the bottle or the bubble pack, you can now see that there are 24 tablets of medication remaining. So next to the 24 on the narcotics record, you will write the date, the time, and of course put your initials. This record now shows not only that you gave the client a dose of their narcotic, but it also shows that after that dose, there are 24 tablets remaining in the bottle or in the bubble pack. This is very useful information should we ever suspect that drugs are being diverted or taken from the facility. If the next time a dose of the medication is given, we find that there are only 22 tablets left in the bottle, well then we know it's sometime between when you gave a dose and the next staff member went to retrieve a dose, several tablets of medication were missing. Narcotic medications have a long history of use in the United States, and unfortunately, they also can sometimes carry a bad reputation of creating dependency and abuse. However, within your facility, using the appropriate controls described in this video, you can ensure that your clients are able to appropriately utilize narcotic medications for their therapeutic medical benefits. Work with your supervisor, follow your policies and procedures, and always adhere to physician's instructions. Much success to you in managing your clients' narcotic medications.